Hello everyone, welcome back to the channel. Today we are going to study one of the most important orthodontic topic for BDS student, development of occlusion and development of malocclusion. This topic is very important for Viva, university exam, MCQs and clinical understanding. Don't worry, in this video I will explain everything in very easy English with a diagram and a quick trick. So student, ready? Let's start. So first understand one thing. Occlusion means the way upper and the lower teeth contacting each other, and development of occlusion means how teeth and jaws develop from birth till the permanent dentition. If this development becomes abnormal, it leads to malocclusion. So question for you, what do we call abnormal arrangement of the teeth? Yes, the correct answer is malocclusion. Now we see the periods of the occlusal development. So there are mainly 4 periods. So first one is prenatal jaw relationship, that is a neonate mouth. Second one is a deciduous dentition. Third one is a mixed dentition, that is a transitional dentition. And fourth one is permanent dentition. So first we will see prenatal period. So before the eruption of the teeth, babies have the gum pad. Okay, so here the maxillar arch is having the gum pad. So here the maxilla is in horseshoe shape and mandible is in U shape, which is firm and pink in color. So in this diagram you can see this is an upper and the lower gum pad before the tooth eruption. Okay. So here these gum pad have 2 portions, that is a labial portion which differentiate first and the lingual portion which differentiate late. So here the pictures show the groups and the division which is present in the neonatal gum pad. So which portions differentiate first? That is the labial portion. Okay. Now we see the dental group. So it separates the 2 portions of the gum pad. So this is the dental group. So this is a dental group which is differentiate the 2 portion of the gum pad. Transverse group. So here this means the gum pad are divided into the 10 segments. So you can see the lines. So this is the lines which is dividing the gum pad into the different 2 segments. So this one is line. Okay. So here easy trick is transverse group means 2 segment division. So this is a line. Okay. So how many teeth are present in primary? That is a 5 teeth are present in each segment. So here also the pad are divided into the 10 segments. So you can see now the lateral sulcus. So here the lateral sulcus is present between the canine and the first deciduous molar. So this is the lateral sulcus. So this is the lateral sulcus. So here you see your canine and here you will found your first deciduous molar. Now we see the infantile open bite. So here it means it is a contact between the upper and the lower gum pad in the first molar region, that is a hair. Okay, so this is a contact between the upper and the lower gum pad in the first molar region, and this is normal in babies because of the tongue thrust. So the lower image show the tongue which is placed between the gum pad which is causing the open bite. So is infantile open bite is normal in infant? Yes, it is normal. Okay. So now we see the deciduous dentition stage. So this period starts from the eruption of the first primary tooth till the 6 years. Okay, so eruption of the first deciduous tooth to 6 years. Here the eruption sequence is A, B, C, D, E. Okay, so it is overcome by increasing the jaw growth and the buccal placement of the tooth jump. Now we see the clinical features of the deciduous dentition. So first one is the both dental arch are half round in shape. Almost there is no curve of spice present. Shallow cuspal interdigitation and there is slight overjet and overbite. Okay. So here important point is the primary teeth are more upright. Okay, now we see the overjet, overbite and inclination. So overjet means that is a horizontal overlap. So this is a horizontal overlap. How much is this? And overbite means that is a vertical overlap. That is here this is a vertical overlap. That is how much vertical overlap. So here in primary dentition the overjet will be 1 to 2 mm and in permanent it was 2 to 4 mm. Okay, now we see the interincisor angle. So here in primary it was 150 degree and in secondary, that is a permanent, it was 123 degree. So here the image which compare the upright primary incisor with a more procline permanent incisor. So which dentition has more upright incisor? That is a primary dentition. Okay. Now we see the spacing in children, which is the normal features in children. So there are the two types, that is a spaced dentition and non-spaced dentition. Now this dentition is also divided into two, that is a physiological spacing, or you can say the interdental spacing, and the another one is primate space. So what does it mean, this spaced dentition? So these are supposed to be good because space present in between the primary teeth can be utilized for accommodation of adjustment of permanent successor teeth, which are always larger in size. Okay. So first we see physiological space. So this is a space which is present in between the primary teeth. So here the image show the space between the primary teeth. You can see this is space is present. So here the important is it prevents the crowding later. So it play important role in normal development of permanent dentition. So average space in maxilla it was around 4 mm in maxillary arch, and in mandible average it was 3 mm in mandibular arch. Okay. So why are space good in primary dentition? Because the permanent teeth are larger. Now we see the primate space, which is very important Viva question. So these are the prominent space. Okay. So in location, it is present in between the lateral incisor and the canine in maxilla. So you see, this is a maxilla, which is here. The space is present between the upper lateral incisors and the canine. So this was canine. Okay. And in mandible, it was between the canine and the first molar. So this was canine and this was the first molar. Okay. So the image clearly marks the primate space area. So here the easy trick is maxilla here is mesial and mandible means distal. Okay. So you can learn by this. Now we see the importance of the spacing. So spacing helps in relieve the incisor crowding when large permanent incisor erect. And second one is it prevents the mesial shift of the permanent molar teeth when necessary. Okay. So now we see the primary canine relationship. So most stable relation in primary dentition. So first it is primary canine relationship is one of the most stable in primary dentition, and it classifies as class 1 here when mandibular canine interdigit in embrasure between the maxillary lateral incisor and the canine. Okay. Class 2nd, where the mandibular canine is interdigit, which is distal to the embrasure. Now we study the molar relationship, which is very important for the future permanent occlusion. So first, the relationship of the distal surface of maxillary second and mandibular second of the primary molar is one of the key factors that influence the features occlusion of the permanent dentition. Okay. So first we see the flash terminal. So here flash terminal means it is the most common relation. So definition is here the distal surface of the upper and the lower second molar teeth are in same vertical plane or in straight line. So here the picture shows both the molars are ending in the same line. So they are ending in the same line. So which terminal plane is most common? That is a flash terminal plane. Now the second one is mesial step. So here the lower molar is more mesial. So here the lower molar is more mesial to that of the upper. That is the second molar. Okay. So this is a lower molar. So it is more mesial as compared to the upper molar. So it is favorable to guide the permanent molar into the class 1 relation. Okay, when mesial step is found, it was converted into class 1 in future. Now we see the distal step. So here the distal surface of the lower molar is more distal to that of the upper molar. Okay, so here it may develop into the class 2nd. Okay, so diagram explanation, you see the upper image, that is a mesial step. This is a mesial, and the lower image is a distal step. So easy trick is mesial good and distal doubtful. Okay. Now we see the anterior bite plation. So overbite means it is a distance in which the incisal edge of the maxillary incisor overlap vertically to the incisal edge of the mandibular incisor. Okay. Here the overjet is here. It is in horizontal distance between the lingual aspect of the maxillary incisors and the labial aspect of the mandibular incisor. So this is very common exam definition. Remember them properly. Now we see the mixed dentition, that is a 6 to 12 year. So mixed dentition where both the primary and the permanent teeth are present together. So it is known as mixed dentition and it is occur between the 6 to 12 years. Okay. So now we see the important eruption fact. So here the transition from the primary to the permanent dentition. So you see the calcification of the permanent dentition begins between the birth and 3 years of age, and here the second molar may not begin calcification until the 5 years of age. So here the crown calcification complete first. The third one is here the enamel calcification is usually complete 3 to 4 years before the eruption into the oral cavity. There is a mandibular incisors are the exception. Tooth crown pierces the bony alveolar crust when approx 2/3 of the root development is complete. So root teeth emergence into the oral cavity when approx 3 to 4 of root developed is complete, and root developed is complete approx 2 to 3 years of after eruption. Okay. So at what age mixed dentition start? Around the 6th year. Now we see the phases of the mixed dentition, which is divided into 3 periods. So first one is first transition period. So here the emergence of the first permanent molar, it includes incisor transition and the establishment of the occlusion. Second one is inter-transitional period, which include containing both the set of dentition for permanent incisor, left and the right first permanent molar, deciduous canine and deciduous first and the second molar. Now the second transition period. So here we get the emergence of the bicuspid, that is the premolar, cuspid, that is canine, and the second permanent molar, and the establishment of the occlusion. Okay. So we see the first transition period. So here the emergence of the first permanent molar. So mandibular first molar is the first permanent tooth to erupt at around the 6th year of age. Okay, so mandibular first molar is the first permanent molar to erupt and it is usually erupt at 6 years. So here you see it is the anterior posterior positioning of the permanent molar is influenced by the terminal plane relationship of the deciduous second molar, which is of pretext, which you see already. Okay, so first you see the flash terminal plane. So here they may show the flash terminal plane position relation. Okay. So the shift in permanent lower molar from flash terminal plane to class 1 relation can occur in 2 ways. Either early shift or it can be late shift. Okay. So early shift means here the erupt force of the first permanent molar is sufficient to push the deciduous first and the second molar forward to close the primate space and establish a class 1 molar relation. So you see in space dentition, the permanent molar push the primary molar forward and close the primate space. So this creates the class 1 molar relation. So this is a primate space. This is a primate space which is present between the canine and the first molar. Okay, so here when the first permanent molar is erupting, so this pushes the teeth forward. So here the primate space is lost. Okay, so using the primate space, it converted into the class 1 relation. Okay, so which space is utilized in early mesial shift? That is the primate space. Now we see the late shift. So here when the deciduous second molar exfoliate, the permanent first molar drift mesially utilizing the leeway space of Nance. So what does it mean? So here is a difference between the primary canine and the molar. So it was this difference. And the permanent canine and the premolar. So this space is left. So this using So when the permanent molar is erupting, so this using this space which is produced by the leeway space, okay, so this causing the mesial movement of the permanent molar. So this is going to be mesial movement. So here the mandible has more leeway space, okay, as compared to the maxilla. As same compare that here also in maxilla, that is a difference between the primary canine and the molar, and this one and the permanent canine molar. So this space is present, but this space is less in maxilla as compared to mandible. So here the first permanent molar is used this space, and then shifting will be forward and causing the class 1 relation, okay. So leeway space of Nance, here the combination, that is a mesodistal width of the deciduous canine first and the second molar is more than that of the combined mesodistal width of the permanent canine first and the second premolar. So difference between the two is called the leeway space, okay. So in maxilla, that was 0.9 mm segment, that is a 1.8 mm total. So this space on one side it was 0.9 mm, and in mandible it was 1.7 mm. So it was more as compared to maxilla, and total in both segment it produced 3.4 mm, okay. Now we see the mesial step terminal plane, where the distal surface of lower second deciduous molar is more mesial than that of upper, okay. So here the permanent molar may erupt in class 1, but if the differential growth of mandible in the forward direction persists, it can lead to angle class 3rd molar relation, okay. Here the distal step terminal molar. So here the distal step of the lower second deciduous molar is more distal as that of the upper. So erupting permanent molar may be in class 2nd or end-on relation if differential growth of mandible persists. Now we see the exchange of the incisor. So here the deciduous incisors are replaced by the permanent incisor. So mandibular central incisor are usually first to erupt. So, okay, so incisor liability. So here the permanent incisors are the larger than the primary incisor. So okay, these are the larger than the deciduous incisor, so they replace. So this difference between the amount of space needed for the accommodation of incisor and the amount of space available is called the incisor liability. The difference in required space is called the incisor liability. So for the maxilla arch it was 7 mm, and for mandibular arch the difference between the so the space which is needed for the accommodation of the permanent incisor, it was 5 mm in mandibular arch, okay. So why do permanent incisor need more space? Because they are larger. So incisor liability is overcome by 3 methods, that is a utilization of the physiological space in permanent dentition and increase in the intercanine width. Second one, and the third one is change in the incisor inclination, that is the labial inclination of the incisor. So here the interpermanent incisor erupt more labially inclined as primary incisor, which is usually upright, and this cause increase in the dental arch perimeter. You already see here the inter-incisor angle. In primary it was 150 degree, which is almost straight, and in permanent, which is more labial inclination, it was 123 degree, okay. So you see inter-incisor angle, it was 150 primary, and in permanent it is more labial inclination, that is a 123 degrees. So this is how the permanent incisors is going to adapt, okay, after the losing of the primary incisor in that space. Now the second period is the intertransitional period in the mixed dentition. So this stable phase is lasting about 1 to 5 years. So here relatively stable phase with no changes occurring in the dentition. Teeth present are the permanent incisor, first molar along with the deciduous canine and the molar. So very little change occur. Third one is second transitional period, which is begin at around the 10 years of age, okay. So in this third period, you see the early duckling stage, which is very important asked in exam, short note. So it is a particular situation which is seen at around 8 to 9 years of age. During the eruption of the permanent canine, as the developing permanent canine erupt, so they displace the root of the lateral incisor mesially. Okay, so during the canine eruption, the root of the lateral incisor shift, the central incisor separate, and midline spacing appears. So this stage is a self-correct later. Okay, so this result in transmitting the force on the root of the central incisor, which also get displaced mesially. It results in distal divergence of the crown of the two central incisors, causing the midline spacing. So ugly duckling stage has been described by the Broadman as during this stage children tend to look ugly, and this condition usually corrects by itself when canine erupt and pressure is transformed from the root to the coronal area of the incisor. Okay. So here the image shows the spacing between the central incisor. So when the canine is erupting, so when the permanent canine is, you see this is a permanent canine which is going to erupt, so it forces the pressure on the root of the lateral incisor, which is causing in this direction to root move. Okay, in this direction you see this is a midline spacing. Now when the crown, this lateral incisor, when this canine reaches on the crown surface of the lateral incisor, so it will force in this direction, causing to close this space. Okay, so this stage is a self-correct later. So should we treat ugly duckling stage immediately? No, because it usually self-correct. Okay. So student, today we study development of occlusion, gum pad, deciduous dentition, mixed dentition, terminal plane, mesial shift, leeway space and ugly duckling stage. If this video helped you, then like, share with your BDS friend and subscribe for more orthodontic video, and comment below which topic do you want next. Thank you.